Hello, everyone. A very warm good evening to all of you, and I welcome you all on the platform of Homeopathy 360 webinar series that is Beyond Boundaries. And today, I'm very grateful to have a very passionate speaker and homeopath with us, that is Dr. Shenbaga. Now, it's time to introduce our today's respected speaker, that is a distinguished psychologist, classical homeopath, trainer, and rehabilitation specialist. With over 2 decades of extensive clinical and field experience, she is known for her unique and holistic approach that integrates psychology and correctional mental health, yoga science, and classical Hahnemannian homeopathy. Her work reflects a multidimensional perspective while remaining deeply rooted in the original principles of homeopathy, allowing her to address complex mental and physical health concerns with a balanced and comprehensive therapeutic approach. Ma'am has served for more than 10 years as a psychologist in various central prisons, contributing significantly to mental health and whatnot. She has also done projects associated with Bureau of Police Research and Development. Ma'am has done BHMS, MSc Psychology, MSc Yoga and Naturopathy, MS Exercise Science from USA, specialization in exercising psychology. Ma'am has been practicing from various years and she has specialized in Boenninghausen methodology, applying the analytical framework developed by Clemens von Boenninghausen. One of her most notable contribution is her work on Boenninghausen's hexameter as a practical tool in modern case analysis. Ma'am has attended seminars and done academic contributions also, and today it's our it's our privilege to have her on this platform, and we are very grateful to have you today. And we are going to learn about a very interesting topic, that is Boni Hussein hexameter, its clinical relevance today. So first of all, ma'am, thank you so much for coming on this platform. And before starting this insightful and very important webinar we are going to have, I would like to ask the reason behind choosing this interesting topic.
Um, During the course of the webinar, you will know it is a very, very clinically relevant topic that has not been actually, it has been overlooked. It has not been used by many practitioners, but it
Yes,
is, we just use it like a theory. Only in the final years or third year we use it and then we just forget it, but it is highly useful. So at the end of the session, you'll also realize the same thing, I hope.
definitely, ma'am. We are very eager to learn from you. Sorry. So, ma'am, would you like to start?
Yes. Okay. Good evening, everyone. I feel really honored to be a part of this program, and especially on this day during the month of Boenninghausen's birthday. I'm really honored to be here among you and present a few things that I have learned and applied in my own practice. Okay. So I first want to start with a question so that we all are in the same page. I always like the sessions to be as a discussion, especially it's around 8:30 at night in India, and I don't want people to feel sleepy or anything. And a discussion always is good. But since this is also a webinar, I know that you're all awake with questions and discussions. So let us all think about what we do. Right, as soon as the patient comes to us, we do the case taking part, of course. And after that, we follow certain things or we use certain strategies to find a remedy. What do you all do? So, what is your focus or what are the steps that you do while you finish the case taking? As soon as a patient enters, the first thing is, of course, the case taking process. After that, what is it that we do? Am I audible?
Yes, ma'am, you're audible.
Yeah. No one is, everyone is sleeping. We follow certain steps, right? Or what do you all do? The first step is, of course, case taking. I hope everybody knows that. Okay. So I hope in everyone's mind something was running in, like we'll look at the generals of the patient or we'll look at the miasms. What are the miasms? We want to identify that, and then we'll choose a remedy based on whether they have a psoric miasm in the background or some things like that. Or certain people might think that it is the particulars that we are very keen about, and we know certain people have keynotes and they just want to prescribe through that. So we do a lot of different things right after our case taking. And but we all don't have a uh, common agenda. Everyone differs in what they choose or how they go about after case taking in choosing a simillimum. So which symptoms are important, which ones are we going to consider? All this is very very different among different practitioners, and that is a very big loophole of homeopathy. Any doctor that we ask, they give importance to different things. So one person looks at only the mental generals, one person looks at just a keynote symptom, and one person repertorizes the case in a different way. Some people don't even repertorize, they just look at the Metria Medica. So there is so much differences. And we all know the patients are also different. A patient with the same disease symptom might have various different issues that they report us. And the symptoms also differ. with the same symptom. Say maybe a patient has neck pain, but or cervical spondylosis, but the patient might not have neck pain at all. They might just have tingling in the arm. So the symptoms are also so different, and we all need a common solution to this problem. This is a pertinent issue that has been around from day one till date of homeopathy. Which symptoms are we taking and how we are, what is our approach? That is so varied among all homeopaths. I hope you all have been on the same page, and certain people have come to a mindset, and that is what Dr. Allen also tells us. So when I read P.F. Allen, he has told that the experience, whatever experience that we have already got, is the final verdict. Based on our experience, if we have had success with using just keynote symptoms, then that is where we'll go. If we have had success with using mental generals, then that is where we'll go. But this is very arbitrary, and we can't base our prescriptions on this. Especially budding homeopaths or newcomers are always confused with what am I supposed to do, because they see different doctors and they all have different approaches. But it is highly important that we all are on the same page, right? So we go back to our master, of course. Whenever we have a doubt, or whenever there is something wrong with the tree, we don't look at the branch of the tree, we go to the roots. So, going to the roots, we have to go back to Master Hahnemann. Master Harriman has told a lot of things in his organon, lesser writings, and his chronic diseases, which most of us, even chronic diseases, is the less read book among even popular homeopaths. Even popular homeopaths have not, I have seen homeopaths who have been practicing for 30, 40 years, but they haven't read the chronic diseases even once. We know what the issues are over there, but still, it's important for us to go there and look at what our master has told us about. So let's go back to our chronic diseases or organon and look at this one aphorism. The more striking, singular, uncommon, and peculiar characteristic signs and symptoms of the case of disease are chiefly and most solely to be kept in view. So, what are we going to look at is only this. So, this is a very popular aphorism. I hope you all know which aphorism this is. Can anyone guess the aphorism here? You can even type it in the chat box. Hello. Hi, I think people are having problems with interacting. They are not able to either post in the chat box or uh, unmute their mic. Can you look at it, doctor? Hello, am I audible? Okay, I see the chat box and there has been different answers. So I'm not getting it on my phone. Okay, I should have looked at the chat box. I think she started me and maybe she's not here. Okay. 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 So can you guess the aphorism? I think over the phone you might not be able to look at the thing. Okay. So okay, good. I get one answer. 153. Okay. Okay, so we all know this aphorism, right? It is the most popular aphorism and a very important aphorism, which we all have read, reread, and we also want to apply. This is the most practical aphorism of all the aphorisms. And we have to read and reread it so that we understand what are the symptoms that we are going to look at. And master says, choose the ones that are characteristics. So what is characteristic? He has given a few keywords. Those that are striking, those that are singular or uncommon or peculiar. Each word has a whole lot of meaning here. We have to probe into each word here and look at the depth, the meaning of it. Therefore, but still, we read this and we have a lot of other aphorisms also which talk about which are the symptoms to look at. But still, we are not clear. Each person has their own understanding of the aphorism and they look at it in a different way. However, it is important for us all to come to the same grounds, which is which symptoms to give high value, which symptoms to give a lower value for the drug selection and which are the symptoms that we have to disregard and not choose at all. And we need a scale. Everywhere we go, which one is of greater value, which one is of lesser value, we need a scale so that we can judge what is important and what is not important. So this same confusion that we have in 2026 was there in 1850 also. There was so much confusion that Boenninghausen asked them all a question. So he said during a conference in Brussels, he asked fellow homeopaths to write an essay. So he asked them to either write an essay or send it to him across as a letter or post it in a journal on how do you judge? He wanted this to be talked about, the judgment concerning the characteristic value of symptoms. So he wanted people to talk about it and write about it. And he announced a huge prize money for the same. And he waited. He kept waiting for 6 months, 1 year, 3 years passed by, but still he didn't get an answer. Even stalwarts of those times who were practicing and were pioneers along with Boenninghausen during his times, they didn't give an answer to this. And at the end of 3 years, he said, no one has given me an answer. Let me myself publish this. And he wrote an essay on that. This is a very important thing. He wrote an essay on the scale as a development of aphorism 153. What are you going to judge and how are you going to give value to the symptoms that you get? As soon as you finish your case taking, you get a set of symptoms. What are you going to do with it? And he gave us a metric measure. That is how we have to call it. It is an anchor. And I hope everybody has looked at this word. As soon as you look at this terminology, hexameter, what strikes your mind? Just put it in the chat box so that I can read it. So, what strikes your mind? What is it that is important? Or as soon as you hear the word hexameter, what comes to your mind? Not audible? Am I audible now? a measuring device kind of thing. Okay. A measuring device kind of thing, anchoring confidently. Okay. So what is hexameter? I hope you all have read about it during your college years. Shenbaga ma'am. Okay. 6 points. Okay. Concept of totality. Nice. Okay. So this is a very important tool that is, as I told at the beginning itself, which has been not used properly, or we just read it as if it is a big 14-mark question for us during our exams, and we read for our exams and remember those 7 words which is in some other language, write it and then forget it. That is not how it has to be used, and it has a great clinical significance. So let's look at that. So the essay that he wrote, the title itself gives us so much input on how it is going to be used in our clinical practice. So he says it is a treatise concerning the greater or lesser characteristic value of the symptoms occurring in a disease to aid as a norm or basis in the therapeutic selection of a remedy. So this is, when you look at the last part, it is important for the therapeutic selection of a remedy. So, if you want to choose a similimum, if you want to choose the right drug, then this is a basis. This is a norm that you have to follow. This will guide you. This will aid you into choosing the right remedy. How will you value the symptoms? There are certain symptoms that gain greater value, and there are certain symptoms that has very less value after your case taking. So if you look at it and then you select your remedy, then there it is. That is what he has talked about in those few pages, and I think this is a roadmap. This is a very important step by step process. If you stop at all these stops and then go, your destination is arrived. Your destination of Simlimum, you get there very easily, very quickly, confidently, like a mathematical formula. Everyone will reach the same end if we do this. So this will give you authenticity and the mathematical accuracy. Let's learn what that is. So we all know these words, I'm sure. Quis, quid, ubi, cubis auxilis, cure, cumando, cuando. We all know this, right? So the 7 important points. So this was derived from theology, which is well known to everyone, and it was also used used by lawyers for knowing at the moral character of a criminal. So therefore, these were coined there, and Boenninghausen found it really useful as a guide during case taking and right after case taking also. But it is a very huge topic, and I'm not sure we can cover all of it. We'll just deal with quiz. We all know what quiz is. Who is the patient is quiz. Yes, very nice. So the 7 important points of the hexameter. So quiz, who is the patient? So we all know, have to know, as an individual, who is he? We always give importance to the individual as a person. Okay. So what is his natural disposition? And what is his mind? What is his mental makeup? What is his spirit say? What is his intellect? Is he a Buddhu, or is he a really intellectual person? Is he a moody or a very laughing, happy person? Intellect and mood. and the emotional disposition and feelings. How does he react to various things? Does he have a lot of feelings? Is he sentimental or not? And things like that. And his physical characteristics, like is he obese, or is there emaciation? Is there discoloration, or is the person bald headed? Things like that. And the objective constitutional signs that we see, pot bellied, and they might have warts, etc. So all this put together is the individual as a whole, and who is a patient is really important. Okay, so we all always take this, right? As soon as the patient walks in, we first look at him and look at his stature and do look how he is and all that. And during the case taking process also, we all get the mind symptoms again and again. However, so this is the first thing that has to be in your case taking. That is what Boenninghausen says in the first few lines. The next few lines gives us what is more important to be looked at. We have to look at the changed mental disposition. How has it changed? So there is one thing that is normal or natural, and with the disease, there is something that is changed and the degree of change. So he says that note what is changed, how it has changed, and the degree of change. Okay. Say for example, we have a monkey and the monkey is our patient. What do we expect from this monkey? What will be his behaviors? Who is this monkey? Who is this patient? What will be our answer? What do we think? If we think about a natural disposition of a monkey, what is it that we will have? Please post your things in the chat box. Very naughty, yes. Capriciousness, okay. Jumping, yes. Restless, happy, yes, restlessness. Right, right. Whenever we think of a monkey, it is his restlessness, his jumping from place to place, and things like that that will pop in our mind. So that is the monkey's natural disposition. We all know that. However, so this is how he will be. He'll go from one tree to the other. He'll eat bananas. He'll throw things and things like that. But that is the natural disposition of a monkey. However, if a monkey is sick, he'll be lying down. That is the changed disposition of the monkey. Then what Boenninghausen says is don't separate your quiz into sick days and well days. The changed thing will be the sick day. The monkey is lying down, it is not moving at and all that is during the sick days, and during the well days, it's jumping and doing all that sorts of things, naughty stuff. So the altered ones is the 6 days, and the well days one is the natural one. So only if we know the how a monkey will react or how a person is during their well days, we'll know what changes has taken place, and we will take the only the changes that have taken place into account. What has greater value is the changes that has taken place. The alterations or the changes only has to be taken into our repertorial totality or into our totality of the drug selection. The drug has to cover the altered mind, the changed mind. So, say for example, a person, so if there is a fine line of difference between altered and changed. Altered is degree of change. Usually angry person becomes really very angry. So a person who is talkative 1 plus might become highly talkative, like 3 plus you'll give, going on chattering and talking. That is altered. However, the opposite of anger. Say a person is mild and angry. Sorry. say a person is angry and he changes into crying or weeping disposition. So that is also most important to look at. That is the thing that we have to give more value for. Sorry, my laptop. Okay. Okay.
Okay,
Okay,
I
I
think
think
this
this
is
is
so.
so.
Okay.
Okay.
Hello. Hello.
Yes, my screen is visible now.
No, ma'am.
Just a second. I think it takes some time. Okay, sorry for the interruption. I forgot to switch on my laptop. Okay, so well days and sick days, that is where we were. So it is very important for us to look at the how a person is during the well days, so that during the sickness, what happens to him is really visible to us, and the differences and the altered or changed behavior, altered or the changed mind is what we have to take. So who is the patient and how is the patient altered into? The same thing our master has told us about in these words. The physician takes note of nothing in every individual disease except the changes in the health of the body and mind. So he says this in aphorism 6. We all know that aphorism 6 is well known for as an aphorism for unprejudiced observer, but this is one other most important thing. So we have to look at the changes in the health of the body and of the mind, not just the body, but also of the mind, and that is where that is the characteristic. This is what he talks about as characteristic in aphorism 153. We have to relate both these aphorisms and read to apply the mental generals of the patient. Okay, so now we'll go into a case. I had a case of an 18-year-old female. She was a really studious person. She got into, she used to study really well, and as soon as she finished her 12th grade, she got placed with full scholarship into an undergrad course in Singapore, and she was doing her first year, and she developed wrist pain. Her right wrist was so painful, she found it really hard to even write her exams. Even just lifting it a little bit caused her so much pain in the wrist, and she was not able to lift even a light load to lift a bag or her bag to and from the college and or whatever. And it was really well when she rested her hands. She had her final exams, and as soon as the exams were over, she came here to India for around 10 days of break. And right after she went there, she had to appear for another exams. So she was really worried as to how she'll write her exams. She was feeling very low and unhappy because she has been there for around 6 months all alone without parents. She was a teenager, undergrad. Even if it is grad school, it will be a bit different. But she was in her 15, 16 years of age, and she was really weeping now and then. And these were the words that she used to describe herself. I feel dark, stressed, and helpless. I was weeping without a reason. I sit in my room and weep so much, and that makes me so sad. And she does all her cooking and stuff, and she will put the milk in boiling, but she'll forget to switch it off, and it'll boil over. So that much insecurity or her mind was off that much. And these were the words that she used, that I'm a bit out of the loops. And for the past 10 days, she hasn't gone anywhere. We all know, right? When there is a teenage girl coming home back in India and she has to leave again, how much shopping they will do. They'll want to buy various different things. She didn't do anything. She was just sitting in her home and she was not even able to prepare for her upcoming exams, and she just wanted to be alone. She's usually an irritable person, but right now, she was very irritable. She was angered at her mother, and her mother told me, even if I ask her to eat, every time I ask her to eat, she'll get so angry and bombard me with a lot of her inbuilt anger. So this was her state, and I did her repertorization. So I took in all these symptoms: wrist, aggravation movement of the affected part, right side, ambulation resting, ambulation rubbing, ambulation warmth in general, aggravation writing, and of course, she felt sad and dejected, and she felt better when she was alone. So all these symptoms pointed out to really well-known drugs like Naxomica, Bryonia, Ignatia, and things. So after I looked at this, and even without the mental general symptoms, I put another chart and it said all these different remedies. So what am I to select? I go back to the master, and in aphorism 211, he states the preeminent importance. He says that the mind symptoms are preeminently important, very important, of the emotional state holds good to such an extent that the patient's emotional state often tips the scale in the selection of the homeopathic remedy. Let us all imagine what is tips the scale. So we have a scale and we are going to buy something like, say, for example, a kilogram of brinjals or something. Then there is the weight on the one side, and on the other side you start adding brinjals. When will the scale tip? It will tip when you add the last brinjal there, after that 0.9 kg is crossed. So that much importance you have to give to the emotional state of the patient. The changed emotions have to be taken in that regard. It has to be used in the final selection of the remedy, and this will be the decidedly peculiar sign which is very, very important in selecting a homeopathic remedy. Therefore, I go back to my patient and look at all the physical generals. I get 4 or 5 drugs and and the modalities and stuff like that, and I get 4 or 5 remedies. What am I to do? Now I have changed and altered mind symptoms. When I have to look at it, because that is what will tip the scale towards the right remedy, right? So I go, this is what Master has told. The same thing again, Boenninghausen has told in his quiz that this will help us in narrowing down the final remedy while thrusting aside all other remedies. So you can just push off all other remedies, and whatever remedy covers this changed mental picture, that is what you will pick as the final choice. Now we got Naxomica, Bryonia, Ignatia, etc. Right? So Naxomica is irritable. We all know that, and the irritability is altered to a certain degree. And we all know Bryonia. Bryonia is also kind of an irritable remedy, and Ignatia is dull and has some sadness, weeping. So, which remedy to find? Here we have 2 or 3 mental generals that has changed. Then I go to Materia Medica, and I see that all these changed mental disposition of the patient is there in one particular remedy. This is from Herring's guiding symptoms, and I see that line by line the drug was as if it just matches the patient's totality as a whole. Of course, I read the risk symptoms and it matched in all 3 drugs. So to ballpark on a drug, I read the Materia Medica. Great depression and very morose mode without any cause, quite contrary to his habit. Usually, she's not a very depressed person. Right now, she was so moody and morose. So that matched. And apprehension, uneasiness, and dread of future. So earlier, she was such a bold girl. She went to Singapore all alone to pursue her degree. But right now, she was afraid of going back because she was feeling so low, anxiety about future, particularly. Okay. And another symptom, yeah, great despondency, disinclined to think, exhaustion of intellectual powers, both mental and bodily quietness is required. She's not able to come to terms with what is happening and all that, and she wishes to be alone. This exhaustion of intellectual powers is what she told me when she felt blank, or when she felt a blackout while she was well, the milk was boiling, and she also gave me a few other instances. So this is from Herring's Guiding Symptoms. Can anyone tell me what drug this is? Of course, I gave you a clue. It is within, no, it's not Ignatia. Okay, Bryonia, right. Super. So this Bryonia is the remedy that I gave her, and she felt really well within 1 or 2 days. And she went back to her place, and 0 bar 1 was continued. And after 1 or 2 weeks, she felt really well, and her wrist pain totally disappeared. And then you all know the thing. So, what is the learning from this case is the changed mind symptom is really important, and that will decide, that plays a decided role in the selection of a remedy. Okay. And the second thing of value in mind is if it is striking and rare. If you, for example, you have a person who thinks that he is a prince, and he always wants to carry himself like that. When you look at him, oh, I'm so good and all that, he's all about himself and all that, then that is a very characteristic or striking feature of a person, right? If that is there, then you can use this also. And there is another symptom here where he asserts that he's deaf and blind and that he has got cancer. And the person asserts that she has labor pains. She boasts that she is pregnant. Even when she is not pregnant, she boasts that she is pregnant and she announces her immediate confinement. So, all this, like symptoms like this, which is striking and rare, that is also more value. And the remedy here is, can anyone guess? This, all these symptoms are from the same remedy. Okay, to save time, I'll tell you the remedy. It's Veratrum album. So the second thing that we have to take care is in quiz, when the symptom is striking and rare, that gains more importance. And Boenninghausen also talks about aphorism 1 or 2. Chalo. So we think about the individual personality. What is the importance? Why should we know that? First thing is to know what has changed, right? The second thing is the individual personality is different from the individual genus of the disease. And the individual personality might contribute to the choice of the remedy. However, the individual genus of the disease, the selection of the drug must lie within the individual genus. So these two words are very important here. Individual personality might contribute. It might be there or it might not be there. But the individual genus of the disease definitely has to lie within it. So if it is a changed mind or if it is an altered or striking thing, then it becomes a genus of the disease, right? Then the selection of the remedy must have this symptom. However, if it is a personality feature, it might be added on. It doesn't have to be there all the time. Say, for example, you have a patient and you want to choose Calcarea card for this patient. Then, while you are thinking about it, you see that the patient is the textbook symptoms of fair, fat, and flabby, and it is an obese patient and all that. Then you might, okay, so I am choosing Calcarea. This is an added point. You can add on like that, but not use it before your selection of a remedy. However, if it is altered, if it is striking, and if it is changed, then the remedy must have this feature in it. Okay, So I want to present another case where there was a person, this was a case which we saw yesterday. So I thought it gave me a new outlook about the hexameter. So I wanted to present this case. So she's a mother of two kids and she's a 43-year-old woman and she had left-sided chest and hand pain. She said that it was a pulling type of pain and it was drawing downward. It radiated. The pain started in the chest upper area and radiated to her left hand. And whenever she laid down, she had so much, she felt like shortness of breath and she had to sit up. There was even a slight pressure whenever she touched and showed this to me. If I give pressure, it is increasing. And in the elbow, I had like boring type of pain. And talking aggravated the pain. Even while she was talking, she told me, even when I'm continuously saying the symptoms, I have the pain. And whenever she shouted at the kids, because right now the exams are over and the kids were having holiday, it is increasing every time I ask the kids to do this, do that, or say something. So my pain increases. So we put it in a repertory chart, and this is what we got. So aggravation talking, aggravation lifting, aggravation lying position. It was in the upper part of chest location, and it was tearing, drawing downwards pain, and amelioration lying on the painful side, aggravation movement of affected part, and we got chamomilla. We were like, okay, chamomilla has a polarity difference of 11, and it has and went and read about the chest symptoms of chamomilla, and we were like, okay, that is might be the right drug. And the patient was talking to us and giving us various things about herself, and she was telling us about various things. And then towards the end, she tells us something really striking. The chest pain started after she had anger with her sister. So her brother had asked her for some money. She was not able to give, but her sisters insisted that you have to help your brother. He has helped you everywhere, and she was so much angry. She just said a few words to her sisters, but she didn't let everything out. And after that anger, after that got suppressed, she got this. And she also blurted it out and shouted at her sister a little bit. See how well Chamomilla was pointed, and we got this is how it tipped the scale. And after we put in the psychological symptoms, the emotion, anger, aggravation, she felt a bit insulted from her sister. Therefore, we put in this, and again, we are sure of chamomilla, right? This is how mathematically, whether you add the quiz or not, Boenninghausen therapeutic pocketbook will give a drug that is really suitable. So I wanted to show the difference between both these repertorization. However, the same drug popped up, and we can have a sure shot selection when we use Boenninghausen's therapeutic pocketbook, even if we don't add the mind symptoms. And at the end, the mind symptoms added value, and we were sure that even within a little bit of time, she'll get relieved of her pain. That is how sure shot selection of a drug will be. We can use it with confidence. We don't have to have second guesses at all. So as soon as we throw in the definite symptoms, our BTPP will give you the similimum just like that, and we can use our altered quiz as the end. Okay. And we all have a prejudice, right, about mind symptoms. Any homeopath, we have to take the mind symptoms. Without the mind symptoms, nothing can be done. However, it is important that in aphorism 6, Master has talked a lot about that. I'm sure every one of you know all this. I had a case. I also had the same prejudice. I just want to show a case which took me out of this prejudice and where I had a revelation in homeopathy. So this was an MBBS doctor. You know how a doctor is, right? And she was a recently married person. Even if it is a homeopath, we can try to get a lot of symptoms, try to explain things to them. However, with an MBBS, it is very, very tough to get symptoms. And if we ask them, other concomitant symptoms are so, they'll have a lot of doubts in their mind. And she has passed out of MBBS, and you know how much stress this person should have been. She has been recently married and she is from Mumbai and she has settled in Tamil Nadu. So the changes, so my mind already had a prejudice that she should have some mind symptom. With that, I went into the case and she has been having headaches since her seventh standard, and usually it was on either side, but of late it has come to one side of the face, and usually it is on the left side. And whenever she wants to concentrate, study, she was preparing for her PG examination and she was not able to do that. The main thing is, if the food is delayed, if she takes food after like half an hour after the due time, or as soon as she is hungry, she has to eat. If she doesn't eat, then the headache starts, and even if she eats, it won't stop. You all know this PCM tablet, I think. Even how many hours she takes, it will give no improvement at all. She has so much nausea, she can do nothing. She just has to close her eyes, sleep. She shouldn't get into a place where you have noise. Any slightest trigger she was sensitive to, and her headache will increase. And she has to induce vomiting and take out every bit of food out. Only then she will feel a little bit of improvement. You know how much agony she'll be in, especially when she was going to her PG. If she gets this kind of headache, she will not be able to do her night duties and 24-hour duties and all that. So she wanted a complete cure from all this, and someone has told about me, and she came to meet me. So hunger aggravation was there, and it was around her left face and head. Even if she watches phone or TV, even if she's reading on a laptop, she was not able to read after a particular point in time. And she took a little bit of cold items, it increases. So only thing that that will not bring on the headache is eating at the right time. So she felt helpless. What am I going to do? And I was probing in, and trying to see what mind symptoms she has. Of course, we all do that, right? If we don't have any mind symptoms, then we know all this background data about her. And I was trying to check her. Do you have any issues during your internship? Do you have any issues with your recently married? So mother-in-law and stuff. However, nothing was changed. And we asked her to come for a second sitting, and we took her case again, and we were trying to probe into all her mind symptoms, and to the point of that person getting slightly annoyed. She was like, you think I have psychiatric issues? And she said, no, no, no. And then that's when we stopped. However, as soon as I finished the case, this is how I felt. So if we don't get mental generals, this is how it is, right? After analyzing all our data, we think that it is all useless. But still, we have to give some remedy to her. We can't tell her no and send her away. So then I had a really good set of LSNC. Therefore, I put this all in and I gave her a remedy, without much confidence, of course. So then, after 1 month of taking the remedy, this is her reply, and it was a really big revelation for me. So I just want to read whatever she sent me. The medicines that you sent through courier are working wonders. It feels as if I never had a headache. A person who has been having headache from her seventh standard and till today, and who is an MBBS, giving this was like a crown to on my head. So the quality of my life has improved so much since then. It feels like I have a rebirth now. So her mind changes in the mind has happened. Only then words like this will come, right? It is not essential that we have to take in mind to for restoration of health. For the person to gain a higher degree of improvement, it is not always essential that we have to dig in the mind, and only if we get mind symptoms, we all have this myth. I just wanted to break this myth. If it is not there, it's not there. Just use the symptoms that the patient gives us. So, um, can anyone guess the remedy? Oops. Natramure? Iris versicolor? No. Hmm. Hmm. Naxomica? No, not Naxomica. We'll wait for three more guesses. Spitlia. I don't even know the drug. Flu. Flu. Calcareophos? No. This is one of the very sensitive remedy of the Metria Medica, and it is an antisoric. I can say sanguinaria, no. Spigelia, no. Okay, let me. Any other guesses? Okay, so it was Silesia. So it was Silesia. I had one big learning from this, which is just be open to what the patient has. We don't have to invent or interpret or probe into what we don't have. We all have this prejudice. We just think that mind symptoms are highly important. Without the mind symptoms, nothing can be done, which I think that is what is being projected even in colleges and everywhere that we go. The patient as a whole, individualization, and all that comes only if we have mind symptoms. If we are an unprejudiced observer, if we want to be one, we'll just go with what the patient has. It is not essential that we have to have mind symptoms that for sure. It is what the patient has, that is what we have to look at. So this case taught me this thing. So if the mental symptoms are present, take it. Otherwise, go with what we have. And whether we have or we don't have the mind rubrics there, BTPP will restore that sick person to health. And if it is an altered and changed mind, it will definitely show up and we can take it. And use the source book references. Like the previous case that we saw, Herring's guiding symptoms gave me line by line what the patient had. So we will use it. And tips the scale is a really useful tool that we have to use. So what are the take home messages? To tomorrow when you go into your clinic, I please apply these things and see and write back to me. So the value of mind symptoms comes from the patient. If it is striking and rare, we can use that. If it is altered, if it is a changed quiz, if it is a person who has become a different, has had a difference, they have, this is the difference that I have seen, which the patient themselves will give you, then you can thrust aside all other remedy and just use it. And it is the same with physical generals too. For example, a person who is usually thirstless suddenly develops a lot of thirst, that is altered. Then we can use that. It is not only for the mind, but also for the physical generals. But if it is the mind, then you can use it at the last resort to narrow down that one single remedy. And the mind symptoms shows a very deep level of understanding about the person, of course. So as soon as we chose bryonia there, we saw that this person has so much changes, and even after giving the remedy, her mind also changed. So the mind symptom shows the changes in mind will also happen if you give the right remedy. And always go to source materia medica. Don't use any abridged version of a materia medica book. And in BTPP, if we put in the remedy, it has an inbuilt thing that this is my observation. You please apply this and see. The remedy of choice has inbuilt mental generals in it. And if we dig deeper into the patient and look at it, we'll see that it holds good. And don't ever skip reading hexameter. If you all want to do one thing, turn on the hexameter pages of your Boenninghausen's lesser writings. It is also available online as a PDF, and read those 5 or 10 pages, which is a storehouse treasure for every clinician. And if we follow those directions alone, our practice will go from leaps and bounds. It will improve leaps and bounds. And if we get another opportunity, we can discuss about the other 6 parameters also. So what are we not to do? We should, when the mind symptom is usual or it is the same, if it is the natural disposition, never ever is it useful in the first few at the as a first resort. We can use it as a secondary thing, add-on point for a remedy, not as in the selection of a remedy. And never pull out symptoms from the mouth of the patient. And the quiz, as it is mind, physical generals, constitution, etc. Don't take it. Don't use unreliable sources, and don't just use hexameter as an exam question. It has so much of practical value given to it. So that is what, if one thing, if you want to change in your practice from tomorrow, please you try to use this quiz as a changed mental general. Then you will see the difference in acute and also in chronic cases. Thank you. Okay. Then don't have file. Thank you.
So, ma'am, many students are saying thank you to you for this
Yeah,
wonderful
thank you.
presentation.
Yes,
And
I'll
any
share
doubt?
the repertory chart in the group maybe.
Yes, yes.
Have you cured a case of thalassemia? Thank you. Um, Thalassemia case, I haven't had cases of thalassemia. However, in our homeopathy medical college, the place where I studied, we have had cases, and though a few patients, three or four maybe, which I saw, and which I saw with my seniors and lecturers. And there are people who have no symptoms, asymptomatic cases are there after giving the remedy. Thank you. Thank you.
And Dr.
Yes, we
Kunal is
have to
saying,
respect. Yeah,
yes, he's saying great
just
insights, ma'am. As you mentioned, we have to respect what patient feels is important rather than what we feel is important and prescribe. It is well said and true.
yes.
So, any doubt or any query related with the webinar?
Which method you're following? I go back to Master Honeyman and try to decode whatever he has said. I know a little bit of organon. I read it again and again, and the chronic diseases. Whenever I have doubts, I go to Boenninghausen. The lesser writings of Boenninghausen is like a guide to me. It's like an addendum to the master's writings. So I read Boenninghausen and then I go back to the organon aphorism, and it gives me greater clarity. So that is how I read nowadays. How do we avoid ourselves from prejudice? Okay, so we should first know that we have prejudices, because as a student of Materia Medica, as a student of Organon, all the knowledge that we have will definitely lead us to prejudices. We should just know that it is not possible for us to be without prejudices. And whenever we, only if we recognize that, we'll be able to go further. So then, whenever we take a case, when something pops up, a remedy, say for example, here I was very much inclined to give Natsomica because, as you might have seen, that was the first in the chart. The person was irritable, angry, and she was shouting and things like that. However, I knew that no, go back to the basics and read the Materia Medica, and Bryonia was the drug which we selected. So whenever you get things like that, write it down in a piece of paper or put it there for you to visually see it, then it goes out of your mind. That is one technique that I follow. Have you given medicine to any breast carcinoma? Yes, we are treating breast carcinoma cases at various stages. Any other reference apart from lesser writings? Yes, lesser writings of Boenninghausen, then chronic diseases. We read lesser writings of Hahnemann too, which is very, very tough to read separately. We have a group of people and we all read it together because a sentence that I can't understand, there is one other doctor who will explain that, and we read it as a group. Even the chronic diseases, we do the same thing. We have a team of homeopaths here in Tamil Nadu. We call ourselves as the Hahnemann Boenninghausen Academy. We are budding. We are in the seed stage, and we are trying to read together and present it to other students and all that. And any other books apart from lesser writings, I have a lot of books to suggest. We read Demetriadis. There is one other website called as the Hahnemannian Institute Sydney. It has a lot of research articles which are very interesting. If you go into the educational articles page, even reading that will take like 6 months if you read for 1 hour every day. And it has various things about Boenninghausen. That is one other thing that I can suggest. What about few symptoms only case like tumor or ulcer or diabetes mellitus cases? As our master has told us, few symptom cases is only because of our own problems, or one-sided is not really one-sided. It is the fault is within the practitioner. So go back and case taking, do the case taking again, or read, do all that, and then you will get enough symptoms. We never have a case with less symptoms at all. What we do if the selected remedy fails? Yeah, even Boenninghausen has given a few cases in his own lesser writings where he was sure that phosphorus is the remedy. However, it failed, and then he went back, took the whole case again, and he saw that there was one thing that he has missed in that patient. And as soon as he put that in, the whole remedy changed, and the second remedy that he gave worked wonders. So that is what we have to do. If the selected remedy fails, go back to the case and retake the case and note down where we have done a mistake. With Boenninghausen's methods and using hexameter, the number of failures are very, very minimal. Obstacles to recovery and how to identify in patient's lifestyle and how to take away these obstacles from the life of patients. In this day and age, there is definitely obstacles like their diet, their lifestyle, their way of life, lack of sleep, screen time, everything. So we give a drug, and if it doesn't act, we go point by point from morning to night what the patient does, how are they built, what is their stress level, etc., etc., and look at it. If there are any obstacles, we try to change it. Of course, this is a very important question, and if we don't address this, the obstacle will not let us, even if we give the right remedy, the cure won't happen or there won't be the desired improvement. So we look at the obstacles. Should take mind symptoms of childhood or present mind symptoms. Okay. This is a question that shouldn't come up after 1 hour of me telling you that you always consider the present changed mind symptoms alone. The mind symptoms from childhood, if it is altered or changed right now, then we have to take it into account. The mind symptoms from childhood or whatever the natural disposition of the patient is never to be taken when you prescribe a remedy. Only the changed present totality is most important. It's the only ones that has to be used. Okay, I think that's it. I thank you for the opportunity.
So ma'am, I guess we have covered a lot of queries, and you have shared a lot of information with us today. So ma'am, I guess we have covered all the questions. It's time to wrap up.
Okay,
Thank you so much, ma'am, again
thank you.
for giving us your valuable time. And no doubt, session was really very informative, and you have shared different techniques and the principles. We have revisited our homeopathic principles and laws. Thank you so much for teaching us, ma'am, today.
Thank you.
And
The pleasure is mine.
thank you, ma'am. And session will also be available on the YouTube of Homeopathy 360 very soon. All right, ma'am. Thank you so much, ma'am, for joining. So,
Bye. Good night.
good night, ma'am.